What's going on, everybody? Welcome to the webinar tonight. I'm really excited about this. This is our first webinar, and it looks like we've already got 900 people in the room. So I'm really excited about this, you guys. And before we get started, just where are you guys from? You guys know me. I'm from Texas. It's a great day here in Texas. Hi, everybody. Gabby, Tracy, Norma, Amy. Okay, let's go really fast. So where's everybody from? Nurse brothers, nurse sisters, what's going on, everybody? I saw Virginia Beach. I saw California in there. I saw Florida, Texas. All right, another Texan. Texas, Oklahoma, nice. Michigan, Boston, Venezuela. That is incredible. Awesome. Colorado, New York, Spokane, Austin, Texas. Love Austin, Texas. Memphis. I'm trying to catch Boston. I love Boston. Boston is one of my favorite cities to visit. My sister has run the Boston Marathon a couple times, and it was such a great time to be there. Let's see. I saw Washington. Love Washington. Let's see. Cassandra from Nebraska. We've talked before. How you doing? So what's going on, guys? What's going on? What year are you guys in nursing school? Because right now we're going to be talking test-taking strategies. So this is going to help you whether you're in your first year of nursing school. If you haven't started, New Zealand. I saw New Zealand. My wife and I traveled to New Zealand before we had kids. It is an incredible place. Australia, cool. Junior, senior, first semester, last semester, awesome. Anybody out there already take the NCLEX? Senior, first semester, graduated, awesome. Good. So we have people from every stage of nursing. Take the NCLEX, great. Guys, this is awesome. I'm excited that we have people from every different stage in this, okay? So you guys, I'm so humbled that you guys are here tonight. I'm so excited. We have right now, it looks like about 1,200 people in the room, and I am just really excited to share this stuff with you too. Got ATT, awesome. That ATT is authorization to test. That means that now you can schedule your NCLEX and go for it. So cool. I hope this really helps you. Taking the NCLEX, good. You guys, I'm excited about this. I want to bring you guys as much value as we can. I'm going to go ahead and switch over here to share my screen with you guys. And what I have on here, guys, let's see. All right. So what we're going to do, guys, failed the NCLEX twice. We're going to help you here with that tonight. We're going to help you that. Carolyn, about to sit for the NCLEX. Remar review, great. I've actually had Remar on the podcast a couple times, or once. So what we're going to do, guys, is we're going to talk how to pass any test in nursing school, okay? So I'm really excited with this. You guys, I learned these steps, these tips, my first semester of nursing school. My school had a student success center. I read a few books, and I analyzed all the tests I had taken because, as you guys know, taking tests in nursing school is not like taking a test anywhere else, okay? And you guys, let me say one thing really quick about the chat. I have my wife, Sandy, manning the chat as well as she can. We had a much bigger turnout for this than we thought, but she's going to try to manage the chat as best as she can. If you guys have, the webinar should last about 45, 60 minutes. We will have a replay as well that you'll get a link in your email for eventually. So she's going to man that as best as she can. I'm going to also go back and respond to questions later, but I want to try to get through this information. And so I'm going to try to get back to this as quick as we can too. So you guys know that taking tests in nursing school is not like anything else you've ever done before in your life, right? And I want to tell you guys a quick story. This is me a couple haircuts ago with my son Taz and my daughter Kai. You can see how excited she is. And last fall, I took my kids and my wife. We went to Croatia, and we were there for a little bit. Stayed in Airbnbs. It was just an incredible time. And this is me, jumping into the ocean. Now, one of the things we visited while we were in Croatia was this national park called Krka, Krka. It was a spectacular waterfall. We woke up really early one morning, took a 2-hour bus ride, then a 30-minute, 40-minute boat trip, and then we hiked up around this mountain here. And when we came back down to this little pool here, we found out that you can swim in it. You can swim up to those waterfalls. So awesome, right? Great experience. So my wife and I started swimming in there with the kids. And then our kids started getting tired, right? Everything was beautiful. Everything was perfect until it wasn't. After about an hour or so of playing around there, my daughter, Kai, she's 3, she started getting tired. We didn't plan very well for this trip. And I realized very quickly, oh, crap. I'd taken my daughter away from my wife and my son, and I'd taken her over to a beach area. And once I realized she got tired and she was ready to go, she started getting upset. I realized there was a huge crowd, and I had no phone. There were no phones that we could use. Our SIM cards didn't work. We didn't speak the language. Croatian is a very odd language. There was no transportation. There was no way to find my wife. They didn't have a PA system. My daughter was crying, and I didn't have any clue where my wife was. So I realized very quickly we were lost, and I had no way of getting back. Okay, and I want to liken that really quickly, you guys, to becoming a nurse. You guys know exactly where you want to go as nurses, right? You want to become an RN. Some of you are just starting the path. Some have your ATT. Some already have your NCLEX scheduled. But what happens a lot of times, guys, and what we're going to try to help you with tonight, is that sometimes we lose our direction, okay? The how becomes lost, okay? Does any of this stuff sound familiar? You've probably seen some of these memes. Some of the memes are, so if you guys aren't seeing anything, just click refresh. Some of the memes, nice try, but that answer was not the quote unquote most correct answer. This baby here, hold up. That's not what the book said. And then this comment down here is one we got on our Facebook group really recently. Someone stated that they just came from one of the most confusing senior lectures ever. The professor made them feel like idiots, asking stuff that they had never heard of before, assuming they knew everything on the PowerPoint. Test is on Monday, right? I think a lot of this sounds familiar to you guys. Our mission at NRSNG, I know a lot of you probably know us. A lot of you are familiar with this. Some of you may not know what we do. Our mission is to provide tools and confidence to help you succeed. We don't adopt the popular framework of the School of Hard Knocks, or it was hard for me, so it should be hard for you guys. We don't want you to just drown in information. Instead, we want to provide you with everything that you need to know to learn it well. Okay, and that's what we're going to do today. What we're going to learn today is I'm going to share with you guys 11 actionable tips for analyzing nursing test questions. And what I want you guys to get from this, my goal is that you're going to gain a renewed confidence when entering your next test. Okay, so as we get going into this, guys, this method and what I'm going to teach you, these 11 steps, I think you can start applying tomorrow on your next class, okay? So I want you guys to focus, though. I want you guys to close Facebook, close Instagram, Snapchat. I want you to put your phone down and really dial into this lecture. And if you have a minute, grab a piece of paper, grab a pen. But you guys, I am going to give you some notes at the very end. I'm going to give you this nice PDF that kind of has all these 11 steps outlined, but you will remember much more what you take notes on. Okay, so take some notes, take out a pen and paper. Even if you throw them away after this webinar, take a couple notes. So who is NRSNG? What we are is we really are a community of nurses focused on changing nursing education by providing you the tools and the confidence to succeed in nursing school, on the NCLEX, and in your life. We really try to do that by cutting the fluff and giving you what you need. These 8 people here, this is some of our team. Okay, up here in the left is Heather. A lot of you have probably spoken with Heather over social media. This is my wife, Sandy. She's manning the comments here. Hi, Sandy, thanks. This is me down here in the bottom right corner. We have Susan and Katie. You guys have probably heard before. And then we have Anna, Nathan, and Taylor. This is part of the team, you guys. I'm very proud of this team. I'm very excited for this team. So can someone mention to people who aren't seeing the webinar yet to refresh their screen? I think that's going to help. All right. So let me tell you a little bit about myself. I'm RN, BSN, BS, CCRN. I had a previous degree before going into nursing. I founded NRSNG in October of 2014. That's when our very first podcast went live. I've been a neuro ICU nurse, a co-team nurse, a preceptor, a charge nurse, and now, a teacher with NRSNG, and I love it. Now, the reason I started NRSNG was about a year into my career as an ICU nurse, I realized that I hadn't been taught the way I should have been taught. I realized that there were some ancient teaching methods being used, and I realized that nursing students deserved better. I've told the story a few times before, about some of my precepting experience with student nurses, and I just realized there has to be a better way. So that's really what we did, and that's what we started. So in the past 2 years, we've had about 4 million visitors on our website. We've had about 2.5 million podcast downloads. We have currently about 200,000 social media followers. We've had people visit our site from about 207 different countries. So that's out of about January 2017. So we've helped scores and scores and scores of nursing students, and I'm always humbled to hear, even just reading your guys' comments here, is humbling to me, you guys. I really love it. Okay, so you guys, I'm sorry. My daughter just walked in the room here. So I'm always really humbled whenever I hear from a nurse or a nursing student who has used our stuff. Sorry, that was my daughter, Kai. She just woke up and she wanted a drink of water. Thanks, guys. Yes, we are live. Yes, we are definitely live. We'd put her in bed at 6 o'clock and she apparently didn't fall asleep. So anyway, my favorite comment from a nursing student was, thank you guys. Thanks, Chandra. Was when I'd responded to somebody over email and she said that the response I gave her brought her to tears. She felt like someone finally believed in her and someone finally cared about her. And this is truly humbling to me, you guys. I really, real life nursing, I really love being able to reach you guys and provide you guys the tips and the confidence to succeed. So I want to tell you guys a secret, and this might make some of you mad when I tell this secret, but here we go. The NCLEX isn't hard, okay? You just have to know your enemy, okay? It's kind of like G.I. Joe says, and I think that's G.I. Joe, right? Knowing is half the battle, and that might age me a little bit. Some of you guys are probably a lot younger than me, but knowing is half the battle. So the NCLEX is a beast. Nursing school tests are like nothing you've ever experienced before. You know, in your anatomy classes and things like that, you're just being tested on memorization, rote memorization. Can you remember what bone this is, etc. The NCLEX is different, okay? And what we're going to do is we're going to talk about 11 tips to help you understand that. So let's get into our first tip. All right, here we go. The first thing I want to cover, of course, is SATA questions. Now, who knows what SATA question is? SATA stands for Select All That Apply. All right. This is where more nursing students struggle than any other area, okay? I'm going to give you 3 things to do to conquer SATA questions, okay? And I'm going to call this the SATA Success Pyramid, okay? The first thing I want you to do whenever you get a SATA question is I want you to cover all the options, okay? Whether you have 4 options, 5 options, 6 options, I want you to cover them all up, okay? I'm going to tell you why I want you to do that. And then I want you to evaluate each option individually, all right? And then I want you to change the question to a true-false statement. Because what happens here, what happens with SATA questions, you guys, is a lot of times people will start to try to bunch answers together. They'll say, okay, well, if A is right and B is pretty close, they must be the same, so I'm going to kind of bunch them together. That's where a lot of nursing students get stuck, is they start bunching answer options together, all right? And you can't do that. I want you to cover all the options first, evaluate each one individually, and then rephrase the question as a true-false statement with each individual option, all right? So that's our first one. Second tip is something called absolute words, okay? Have you guys heard of absolute words? Who knows of absolute words? I want you to take absolute words as red flags, okay? Absolute words are the words always, never, none, all, every, all right? If an answer option contains one of these words, it is generally a good indication that it's not a correct option, okay? Because it's really hard to say that any one intervention, any one thing applies to every patient across every population, across every disease process. So if you see one of these 5 words, it's always a really good indication that it's probably not right. And I see Tori up there says only can also be one as well sometimes. So, but however, sometimes you might see an absolute word and think it is correct. If this happens, I want you to ask yourself 2 questions. First, is it a safety issue? And can it be applied to many kinds of patients across a lot of different spectrums? All right, so if you see one of these words and you're like, man, but that really just seems right, ask yourself, is it a safety issue and can it be applied to many kinds of patients? And so, yes, Susan's saying up there, what about always wash your hands? Washing your hands is a safety issue and it needs to be applied to every kind of patient. The example I'm going to give you here is like never lift a Foley bag above the bladder. The reason that works, it's an absolute word, but the reason it works is because it's a safety issue. If you lift the bag up, the urine's going to backflow. It's going to cause a CODI. It's going to cause, it can cause a bladder infection. And so it's a safety issue, and it can be applied to patients in a PED setting, an OB setting, a med-surg setting, in any kind of setting. All right. So that's absolute words. Here's a quick example of this. And I want you guys to go ahead and put your answer up there. Which one you think it is? How can the nurse best improve circulation when caring for a patient, when giving a patient a bath? 1, apply soap to the washcloth, keep the patient covered, use only hot water, use firm strokes. Now, some of these are going to be easier than others, but apply what we just learned here. Option 3 has the absolute word only in it. Use only hot water. Obviously, you don't want to do that. All right, so good. Yeah, pretty much everybody's saying 4, 4, 4, 4, 4. A couple of people saying 2. So 2, we'll just touch on that really quick. 2 wouldn't be correct because keeping a patient covered isn't going to help with circulation other than keeping them warm, but the firm strokes is going to help push the blood, okay, and keep that venous circulation going. All right. Now, another great testing strategy is opposites. Okay, some of these strategies are a little bit more in depth than others. Others I just want you to know and be familiar with. So with opposites, what we're talking about here is we're talking about if you have opposite answer choices, one of them is usually correct. Okay, so if you have like hyperkalemia and hypokalemia as answer options, usually one of them is going to be the correct answer. So examples of this would be like hyper versus hypo, acute versus chronic, overload versus deficit. All right. Now remember, content knowledge is always number 1. That matters more than anything. If you know an answer, go with it. But if you see things that are opposite answer options in your 4 choices, usually one of those ones is going to be the right answer. All right. Here's an example of this. And this one's a little bit different, a little bit tricky, but the physician orders anti-embolism stockings for a patient. When should the anti-embolism stockings be put on? Okay. Option 1, when the patient is still in bed. Option 2, when the patient complains of leg pain. Option 3, when the patient's feet become edematous. Option 4, after the patient gets out of bed in the morning. All right, what do you guys think? 1, 1, 1, 1, 1, 4. Great. So a couple people are saying 1, or most people are saying 1, a couple people are saying 4. What I like here is that you guys have identified the opposite options. The opposite options are 1 and 4, while the patient is still in bed or after the patient gets out of bed in the morning. That's great. So you've identified the 2 opposite options and saying, okay, that's probably right. Then what you can do is you can read 2 and 3 really quick. But in this one, obviously reading 2 and 3, we're just dealing with, we're putting the stockings on after there's already a problem. So we need to look at 1 and 4 a little bit more closely while the patient is still in bed. Okay, this is when we apply our nursing knowledge, regardless of where you are in your nursing program. The nursing knowledge you would want to apply here would be, okay, I know that edema is going to occur as the legs become dependent, and feet are dependent when the patient's standing up. So I'm going to put them on before the edema occurs. So option 1 would be the right answer there. All right, this one's a quick tip here. 4 is same. Okay, same. What we're talking about here is answer options with the same concept are usually false and you can move on. These can be hard to spot, okay? An example of this would be like a patient rating pain of 8 and a patient saying that they have really terrible pain, okay? A pain of 8 and terrible pain are kind of the same thing, so you can really just move on. They're equally plausible, and they're both kind of saying the same thing, so you really just want to move on, all right? That's the same, okay? That's tip 4. We're going to do a question here. This one's just a little bit different, okay? What is the main reason why passive range of motion exercises are performed? Okay, let's look for things that are saying the same thing. If they're saying the same thing, they're generally wrong. Increase endurance, prevent loss of mobility, strengthen muscle tone, maximize muscle atrophy. So the same thing that we're talking about here are things like increase, strengthen, maximize. Things that are increasing, right? The only one that's not increasing something is 2, which is prevent loss of mobility. So even if in option 4, you don't know that atrophy is obviously something we don't want to maximize, okay, you can look at it and say prevent loss of mobility is the only one that's not increasing something. Therefore, I'm going to go with that option. All right. That's kind of an easy question. Everybody's saying 2, 2, 2. Yep, great. All right. Priority. This is the one we're going to spend the most time on. This is the one that I want you guys to really take the most notes on, and I really want you to get the most from this. All right. Priority questions. Why are these so important? Okay, you have to be able to understand nursing priorities. What's important to you? As a nurse, it's all about priorities. You're going to be given 10 million tasks to complete. And by the way, they all have to be done right now. So you really have to identify what has to be done first. Okay. Sarah's saying those are the worst. Yeah, they kind of suck. So first of all, let's talk about the NCLEX is really built on something called Bloom's taxonomy. All right. Bloom's taxonomy is a way to analyze how well you understand something, how well you cognitively mastered a topic. It starts at the bottom with remembering. Like, do you remember what a normal sodium level is? Okay. And then it builds all the way up to like analysis, where you can take a whole bunch of different pieces of information and you can put them together and come up with the right option. All right. And so this is where priority really comes into play. Okay. So how are you going to be able to identify a priority question? How do you know when the NCLEX wants you to know if you can pick the right priority? You're going to hear keywords like priority, emergency, a patient arrives via ambulance, a patient's returning to the floor, what's the most important, and see first. All right. So it's really built on Maslow, just like Daniel just set up there, A, B, C, D, and Maslow. What Maslow's hierarchy of needs is, hopefully you guys have all seen this from, your nursing 101 or your nursing entry to nursing course. Maslow's hierarchy of needs is built on what it really takes to build a complete human being, basically. And at the very bottom, we have our physiological needs, things like breathing, sleep, homeostasis, all the way up to things like creativity. Okay. So that's what it really takes to build a human. We can't worry about our self-esteem if we're not breathing. All right. So what it really comes down to, you guys, it comes down to ABCs. What are ABCs? Airway, breathing, circulation. All right. So that's really our first and most important thing that we have to address. ABCs. And you can see I added a little S here on our ABCs, right? ABCs, I'm going to call that S safety. All right. That's going to be airway, breathing, circulation, safety. All right. Then once we've dealt with those four things, we can deal with the patient's pain. Okay. Then we can educate the patient. And after that, we can deal with their feelings. All right. Now I know in Nursing 100 or fundamentals, all you really seem to talk about is feelings, right? That's your feelings. But while we care about our patient's feelings, right? If they are not breathing, or if their blood pressure is 20/5, but at the same time, they're telling us they're upset that their meal tray is cold. Like, yeah, I care about the meal tray, but I really kind of care about their airway more than anything right now. All right. So we can't educate the patient if they're in a tremendous amount of pain, right? If they have a pain of 10, our education is not going to go very far. If there's a safety issue, we can't really educate. If there's a breathing issue, we can't really worry about their circulation. If there's an airway issue, that trumps everything. So what we're really doing with these is we're trying to identify which of the answer options is closest to A. Okay, which one's closest to our airway? And that's going to be our correct answer. Now, I'm going to give all this in the notes, but this is something that I think is going to really help you. This is going to help. What I'm going to do is I'm going to give you different keywords that are going to help you identify an airway, a breathing, a circulation, or a safety issue. So with airway, you're going to see things like NPO, gag reflex, breathing, water after surgery, dysphagia after stroke, and obviously just stating their airway. Okay. For B, you're going to see things like breath sounds, O2 administration. What's their pulse ox status? Have you raised the head of bed? Incentive spirometry. If you see those types of things in an answer option, you're dealing with a breathing type of problem. C for circulation, the big ones are obvious: heart rate, blood pressure, CPR. But then you also have to think about fluid status, fluid deficit versus fluid overload. Are they having diarrhea or a lot of vomiting? That's going to lose a lot of fluids. They're going to have a fluid deficit there. Things like pulses. Do they have a weak and thready pulse? IV fluids. How much IV fluids are they receiving? Are they on TPN? Do they have central lines? Is there bleeding or hemorrhage? All right. And then safety. With safety, I want you to think about two things. I want you to think about physical safety and infection safety. So with physical safety, we're dealing with like rugs, night lights, with our dementia patients, that's going to keep them physically safe. Do they have a phone? What's their risk for falls? Walking after a narcotic, a lot of times you'll give patient morphine and they're like, I'm ready to go. Let's take a walk around the unit. Or infection as well. So you have to assess infection, temp, hand washing, cultures, antibiotics, wounds, drainage. Okay. TPN is it's total parenteral nutrition. It's nutrition through an IV, basically. Natalie. Okay. So that's really what you need to keep to kind of know where something falls on the ABC scale. So if you have a patient with a heart rate problem and a patient with a GAG or a NPO, you're going to deal with the NPO first, okay? All right. Now, a lot of times what these questions will ask is they'll give you all these things that you should do, and then one of the options is going to be call the provider. All right. And so it becomes really, really tempting to select the call the provider option, right? You're like, well, I don't know what to do. I'm just going to call the provider, right? I'm going to tell you when you should call the provider, all right? Because that's always a very tempting option. And sometimes it is correct, sometimes it's not. So what you need to ask yourself is, does the patient have an immediate significant need that I need to address before leaving the room? Okay. Does the patient have a significant airway issue? Are they hemorrhaging? Have they just fallen? Okay. If they have an immediate need that you can address, do not leave and call the doctor. Take care of that immediate need, handle that, and then you can go call the doctor. All right. Is calling the doctor the most prudent first option? Okay. And that's what I really need you guys to keep in mind here with those. All right. Let's do another question here. This is a priority question, and it's a little tricky because all of these things need to be done. What should be the nurse's first action before administering an enema? Verify the physician's order, collect the appropriate equipment, arrange for the bathroom to be empty, or inform the patient about the procedure. Sarah says 1. Jessica 4, Paige, well, missed it, 2. Okay, great. Okay, so what you basically need to do is, how do each of these 4 options play into Maslow's, right? Verify the physician's order. Boom, that's a safety issue, right? Collect the appropriate equipment. That's implementation from our nursing process. 3, arrange for the bathroom to be empty. That's like feelings, privacy. 4, inform the patient about the procedure. That's education. So what is the most important? Well, most important is verify the physician's order. That's a safety issue. That comes before educating the patient. So we need to make sure that we have the order verified, signed, it's implemented, it's the right order before we do anything else. Okay, great. All right. So safety comes closest to airway before implementation, feelings, education, all that. All right. Now let's talk nursing process. For those that are in their first semester, hopefully you've already started covering nursing process. Before I put the nursing process up there, can somebody spell it out in the comments? All right. Nursing process is ADPI. Assess, diagnose, plan, implement, and evaluate. All right. Yes, ADPI. Perfect. Love it. Never break the nursing process. Now, this gets tricky, okay? And they're going to try to trick you. If a question's asking you what you should do first, you assess something. However, if there's assessment data and they ask what you do first, you intervene. Okay, so you build on the previous one. You assess, diagnose, plan, implement, evaluate. You don't skip something. If you have no idea what the question's asking, because that's what they can do, right? For those that have maybe already taken the NCLEX or whatever, you need to really follow that. Like if you're throwing this really random diagnosis, this really random medication, forget all that, go back to ADPI. Assess, diagnose, plan, implement, evaluate. Even if you have no clue what the question's even asking, follow ADPI. Here's a quick example of this, all right? And this example is a little bit of a stretch, but we'll go with it, all right? A patient is receiving oxygen via nasal cannula. After morning care, the patient experiences dyspnea and complains of feeling tired. When planning for the patient's bath the next day, the nurse should plan to 1. Give a complete bed bath quickly. Bathe only the body parts that need bathing. Arrange for several rest periods during morning care. Continue with the same plan because dyspnea is unavoidable. Now, if any of you pick 4, please don't pick 4. Great. All right. So what this question is really asking, and you can see up here, if you read the question, let's go back. When planning for the patient's bath the next day, the nurse should plan to, right? So they're telling you this is part of the planning portion of the nursing process. All right. So what you need to do is you then go down to your 4 options and say, which one of these is planning something? So in option 3, arranging is planning. You're arranging for several rest periods during your morning care. So what they sometimes will do is, do you simply know how to determine where you're at in the nursing process? Do you know how to take the next step in the nursing process? All right. That one's a pretty simple one. This one's a quick step here. Acute versus chronic. All right. content is king, okay? Content means everything. And what they're going to do with these types of questions is they're going to try to determine if you can identify acute symptoms versus chronic symptoms. So if you have a question about acute renal failure, one of the options will likely be chronic renal failure, okay? Yes, it was 3. So some of the ways that this can be written is it can be written acute versus chronic. It can be written short-term versus long-term, or you might see it as early signs versus late signs. There's not a huge strategy here, but what I want you to do as you're studying is really look at what are the acute, what are the short-term signs, what are the long-term signs, of pneumonia, of renal failure, of heart failure, of kidney, really look at what are the differences in acute versus chronic, okay? So that's kind of more of a study strategy there. Tip number 8, this one is trying to figure out what they're really asking, and what this was my biggest pitfall. This was my biggest downfall. This is where I struggle the most, okay? Because I would start reading a question, and as I'm reading the question, I start jumping to exactly what I think the answer is going to be, okay? And I say, before I even finish reading the question, I'm like, yep, got it, okay, and I start reading the answers without even finishing the question. Never do that. This one's really more about just slowing down and determining what is actually being asked, okay? If you're totally lost during a question, go back and read the part right before the question mark, right before they actually ask the question, because I'm telling you, some of these questions you're going to see are going to be like 10 paragraphs long, and then it's like the question is like, what's the patient's name, So always just make sure you understand exactly what's being asked. The first thing you need to do is remove distractors. Distractors are obviously wrong choices. All right. If you're getting a question about heart failure and one of the options like, you should go to give them some potato chips or something like that, that's obviously a distractor, and you just remove that. Okay. And there will be ones on there that are honestly that ridiculous. And then you need to kind of simplify the question. By that, what I mean is think back to the very most simple part of what's being asked. If you're talking about a cirrhosis patient, simply think back to, okay, what does the liver do? What did I learn in anatomy and physiology? What's the function of the liver? And then never overthink it, okay? What happens a lot of times is nursing students start putting in all this exterior information, exterior data, trying to make the question work for them while it's, to make an answer work. Don't do that. And then determine if they're asking the correct or incorrect, for the correct or incorrect response. That's really where I fell a lot of times was, I'm reading it, and then at the very last part of the question, they're saying which response would indicate a need for further teaching. So really just slow down, read every single question, and determine exactly what you need to know. All right, tip number 9. Now I'm going to try not to confuse this, and I hope it makes sense. This is a really helpful tip because you're going to get a lot of questions like this, and I'm going to try to make it as clear as I can. So I'm going to do my best. All right. This is called duplicate facts. So what happens here is you're going to be given a question, and the options are going to each contain 2 or more facts in them, okay? Identical or similar facts appear in the options. And so what you're really trying to do is you're trying to determine which fact is incorrect, and then try to see where that appears in the different answer options. Once you identify one fact, quote unquote, as incorrect, eliminate all options that contain that fact. Now, I think reading through this question will actually make this make sense, okay? So here's the question. When monitoring a patient who is at risk for hemorrhage, the nurse should assess the patient for. Now, you've probably seen questions like this, I hope. And so what you see here is they're asking us 3 facts about the body. They're asking us about the skin condition, they're asking us about the blood pressure, and they're asking us about the pulse. All right? And so they're going to ask us 4 different scenarios of that. All right? So warm, dry skin, hypotension, bounding pulse. Hypertension, bounding pulse, cold, clammy skin. Weak, thready pulse, so it should be thready pulse. Hypertension, warm, dry skin. Hypotension, cold, clammy skin, weak, thready pulse. So what we really have to do here is we're looking for, if we know one of these facts, if we know, with a patient who's hemorrhaging or at risk for hemorrhaging, they're going to be hypotensive. What we do is we go back to the question and we say, okay, anything that says hypertension, I can eliminate. So 2 and 3 say hypertension. Boom, I can eliminate those. All right, because I already know that hypotension is a sign of hemorrhage. All right, and then what we can do is we go in and we say, all right, I know that weak, thready pulse is also a sign of someone who's at risk for for hemorrhage. So I can then say, look, what's the ones with weak thready pulse? Okay, boom, 4 has that. So I'll keep 4, weak thready pulse, 3. Okay, but I already eliminated hypertension. So by doing that, by working through the fact that I know and eliminating the answers that contain alternate facts, I can determine that 4 is correct. So I hope that made sense. That's a little bit difficult to explain, but basically what you're doing is you're looking for one that you know and then running with it, okay, as far as you can. Now, this really helps when you have 3 or more because it really gives you a higher chance of having a fact that you actually know, and then you can start eliminating other options. All right. So step number 10, this one is repeating words. Now, maybe you've done this before, maybe you've seen this before. This is really a last ditch effort. And I only want you to use this after you've used everything else. You've exhausted your knowledge bank and you have no clue what to do next. All right. So repeating words are what you need to do is you need to look at the question and look at the answer option. And you're looking for repeating words in the question and the answer option. Are there any words or concepts repeated? Okay. That can give clues to the right answer. Now, this is not an end-all be-all tip. This is a last-ditch effort, and I want you to only use it as that. All right. So, for example, if in the question they're asking about hypernatremia, and in the answer options, one of the answer options is sodium of 152. You start kind of pulling those repeating words together. All right. That's all you're doing here. Really a last-ditch effort. If you've tried everything else, exhausted everything else. All right. Lastly, guys, I want to talk about NCLEX question traps. All right. These are 6 traps that the NCLEX is going to throw at you to really see if anything else is if they can really try to trip you up. So one of the places I really love traveling is Pacific Northwest. I love the Pacific Northwest. It's beautiful. I love Oregon coast. I love Washington and all that. One of the things they do in the Pacific Northwest is they do crabbing. All right. And so the way they catch crabs is they put them in these little pots. These are called crab pots. And you can see the way they get them is they have this massive hole here. They put some stuff in there, drop these in the ocean, and the crabs crawl in there. All right. And once the crab crawls in there, they can't get out. They can see the whole ocean. They can see all their buddies swimming around right around them. And they don't even necessarily realize they're in a trap. All right. And so this is how these question traps work. They're built to trick you. Okay. The first question trap that you need to be aware of is no assessment is completed. If there is no assessment in the STEM, you need to assess, but it has to make sense. So there might not be any assessment even done. You don't even catch it. Boom, you jump into doing some nursing care and you didn't even realize there was no assessment. Number 2, an incomplete assessment. And we've kind of talked about this a little bit before. This is where I think nursing students fall in a trap more than anything else. All right, they see, so let me give you an example. So for example, let's say you're working on a med-surg floor, you're taking care of a diabetic patient, right? You walk into the patient's room, they're sweaty and they're shaky. All right, and the question is, what do you do next? All right, where a lot of people will jump to, and as you're sitting here, with all your friends here, and we're just sitting here, it's easy to kind of think of what you would do next. However, when you're in the test and you're freaking out, you're anxious, what will happen a lot of times is you'll jump to somewhere you shouldn't jump to yet. We don't see, yeah, okay, boom, distress, no assess. Yes, so what you need to do is get a blood sugars, check a glucose level. But when you have an option there that's like, boom, give them some D50, it's really hard to avoid doing that because you're like thinking, man, I'm good, I got this, I assessed it, it's blood sugars, I'm gonna give them D50. Never do that. They're gonna try to trick you up with an incomplete assessment. Don't fall for that trap. Incorrect assessment. So what can happen here is the wrong assessment is put in as an option. And this really happens again when you start to assume things. Okay, so a wrong assessment's put in there and you're like, yeah, that sounds great. And so you start jumping after these wrong assessments, and that can really trip up a lot of people. Number 4, first does not always mean assessment. We talked about this when we talked about ADPI. What you want to do here is if they say, what should the nurse do first? It's not always assess. You need to look at, okay, what has already been done? What information do I have? And then I'm going to go and do what's next, okay? Along the same lines, action doesn't always mean implementation, okay? What's been done, what is the question asking, and go from there. Just because it says what action should the nurse take, it doesn't mean you're implementing. It could be you're assessing or whatever, all right? Lastly, you need to determine the outcome of each answer. We kind of talked about this in priority, but what you need to do is you need to say, if I go home right now, okay, if I go home right now, is the desired outcome for my patient done? Okay, so if I do this option and I go home, is it the desired outcome? Okay, so this again comes down to what usually happens is people start jumping ahead of themselves. So they start inferring things from a question. And this really comes down to critical thinking. You really have to think about, and I know that word, can be tough to hear, but you really just have to think about, if I do this option, I go home, what happens? Is the patient safe? Is the patient okay? Is it what I want to have happen? All right. So you guys, what I want you guys to realize is tricks help, but knowledge is king. Okay, knowledge is everything. Yes, as May said, I'm gonna give a link here in just a minute with the PDF download for this. You can just go print it out, and it's gonna have the 11 steps on there. All right. So knowledge is king, and I want you guys to have all the knowledge you can get. Okay. What the problem is, and like this little GIF here shows, is that nursing school is a lot like drinking from a fire hose. We have students every now and then send us pictures of their stack of nursing books, and it's kind of depressingly hilarious, if that's something you can say. You simply you can't know everything. And trying to obtain all that information is pretty much